Here on the bone, and there is here the mandibular ligament. When I inject deep on this ligament, I'm strengthening it. So when I strengthen it, it lifts the face a little bit like this and give me more contour.
I mean, the area that you inject in, you define it by just following the nasolabial fold downwards, or you push the fat to see the area of defect, or you pull both sides down to see where the mandibular ligament. What do you do to detect these 3 points?
First, I do like this. I pull on the skin like this, ya Rahab.
Yes.
Look at this test. I'm pulling the skin. The area of the mandibular ligament here, it's not pulled because there is a strong attachment of the mandibular ligament.
معلش يا أمين ممكن تنزل إيدك لتحت وتوريها لهم تاني, because this is a very nice point to detect. With both hands you pull down until you find the area that is not pulled down. صح?
Look at this area. This area is not pulled down like here.
Yes.
Okay. So this is the mandibular ligament where I'm gonna inject it. Okay. It's not pulled. So I'm going to mark it like this. I'm going to do like this.
He is deep on the bone. He is deep on the bone.
I'm extremely deep.
مش مهم 90 degree.
On the bone.
When you're deep, you're not entering perpendicular.
I'm injecting 0.2 بالظبط.
This is your first point, deep on the bone, on the jawline.
Then, can you see the difference of this 0.2?
Yes, very nice. And when you inject it, you massage to upwards to improve the mandibular ligament attachment.
Not always we need to inject the other 2 points, but now, and with this patient we need to inject the other 2 points. As I said, this will be more superficial.
This is at the level of the mental crease in the same line that he detected.
At the mental crease, and then the last point is very superficial at the corner of the mouth to open it and to give support to the corner of the mouth. I used half syringe only, 0.5. Look at the difference between both sides. Is it evident?
Yes, the angle of the mouth is raised. The commissure is nicer. Her contour is getting better. Even there is a camouflage now to her double chin on one side.
Okay, not. So we can see the difference between both sides.
Yes.
This is the corrected side. Okay. And this is the not corrected side.
Definitely, yes. She has here a downward angle of the mouth. The marionette are clear. She doesn't have a definition of the jawline in this area.
Nothing.
So it's definitely apparent.
Okay. So my last point of injection, I'm going to show very safe points of injection for the angle of the mandible without using the cannula, because we are in a basic course. So I'm going to tell 3 points basic for injection of the angle of the mandible or the jawline with the needle. First of all, we have to mark where is our facial artery. So this is our facial artery. We mark it because this is no-go area. We cannot inject here. Then after the point of the facial artery, I'm going to pinpoint 3 points to inject them on the bone, on the lower part of the mandibular bone. I'm going to inject the 3 small bolus on the lower part of the mandibular bone. And finally, I'm going to inject a little bit, I'm going to augment the angle of the mandible. How can I get the angle of the mandible to inject it? How can I define it? How can I get it or pinpoint it? I'm going to use this mark. I'm going to use these 2 fingers, one up and one down. I'm going to pinch the skin till I feel where is the angle of the mandible. I'm pinching the skin like this, upwards and inwards, and here is the angle of this mandible. Here, I'm going to inject it a little bit. So I'm going to inject here. Mind that if I inject it too much, I'm going to make a wide mandibular angle, which is much or more or less, it is like a man. So I wanted to inject it a very small amount just to give a definition. It's okay, it's okay.
Amin, can you please repeat why are you injecting a small amount in the ankle?
I'm injecting a small amount of the angle of the mandible because I don't want it to make it more bulgy mandibular angle, because it gives more an mannish look or more a male look. So an angle of the mandible of the female, it is always a closed angle and a smooth closed angle.
You mean it's an obtuse angle, smooth?
So in more courses, we're going to explain how to use the needle, how to use the cannula. Now I'm using the needle in small 3 points. I'm going to inject deep on the bone, a small bolus. Intense. Intense. And now this, I'm going to use this movement to determine the angle of the mandible. One downwards, pinch the skin downwards and pinch the skin upwards. Here is the angle of the mandible.
And you're on the bone, huh?
And on the bone, very deep.
All the injection here, guys, was on the bone except the 2 points that we went more superficial till the angle of the mouth. Other than that, it was all on the bone. She is much more defined now. The shadow of the jawline is beginning to be apparent. This is the Texas jaw that most women like. It's very, very nice. It's a feminine look. Can we see this side?
Can you see this side?
Yes, yes, very, very nice. And show us the other side, I mean, for comparison, please. Let her look the other side. Yes, of course, that she has a more defined jawline.
Can you see the
side.
difference between both sides?
Yes, yes, very, very, very nice.
Thank you.
Thank you very much. It's a simple injection. It's a very simple injection. It gets very, very nice results. And it's very, very much wanted nowadays to have the Texas jaw. She can have anything, but she wants the Texas jaw. So I think we all need to inject it in the coming days. Okay. Amin injected me على فكرة. Who wanted to ask a question? Yeah.
About the bullets, each point, how many we can point one?
Yes, in the 3 points between the no-go area of the facial artery until the angle of the mandible, point 1, point 1, point 1, and in the angle you go from point 2 to point 3, point 4. Any other questions?
Can I use cannula, doctor? Can I use cannula to fill in the marionette?
A cannula, to me, is the most amazing thing ever. Yes, of course you can, but you never can go with a cannula on the bone, but you can